Tell us about Geoff Watson.
Well, I'm a native of Tennessee, grew up in Knoxville. My wife's from Nashville, and so I'm committed. I'm here to stay. My wife's family lives here.
Does that mean you bleed orange?
I do, yeah. My wife and I both graduated from the University of Tennessee. So yeah.
Well, we'll forgive you for that because I'm a Vanderbilt product, but but hey, I've got lots of bucks at the University of Tennessee.
I hear you.
But what brought you to the Bone and Joint Institute of Tennessee?
Well, Craig Farrell started our group many years ago. My wife went to Brentwood Academy.
You just redeemed yourself.
And actually knew him growing up, and had friends that came to the Bone and Joint Clinic originally, and heard a lot of good things. And this is where we wanted to settle down. Craig Farrell started the practice in treating patients like family, and that's what we really want to commit to with this new venture.
If there is a saint, it's Craig Farrell.
I've heard nothing otherwise. He's a great man.
He certainly was. Well, let's talk more about the Bone and Joint Institute of Tennessee. You know, it's 3 stories of brick and steel, or it will be 3 stories of brick and steel. But it's not a 3-story attitude. It's a hometown attitude of service.
I would say that's exactly right. It's kind of quality care with a small town feel, and that's what we're committed to. It's a different name, but it's the same great care.
How many physicians, how many orthopedists would you have on staff?
So right now there's 2, Dr. McNamara and myself, and then we were having 10 other surgeons join us on March 21st.
Now, are you a hand guy or are you an ankle guy?
I am a foot and ankle surgeon, so I do everything from bunions and hammer toes to ankle replacements and ankle fractures.
Well, see, one Paul Parsons put a pound or 2 of metal in this ankle down here, and I think it's starting to rust. Can you do anything about it?
Well, we certainly can. Anything from injections to bracing to potential surgical options like infusion or ankle replacement.
Well, so I guess the point I'm trying to make is that orthopedics are not just for athletes. It's for us folks that are up there over 60 years of age and everybody in between. What's the youngest patient you've had so far in your practice?
Well, as you know, we have a children's hospital here too, so there's a fair amount of broken arms and broken legs, and we kind of all help to take care of that. So I've had as young as 15 months.
And the oldest?
I've had a 100-year-old.
Wow.
So,
okay. From your standpoint here at the Bone and Joint Institute of Tennessee, what's easier, the surgery or the therapy that follows? Easier. What's more important?
Yeah, I think it's hard to put a marker on both of those things because it's important to have a good surgery. You want things to be well aligned and in the place they need to be and balanced. But then therapy is, I'd say, equally as important. You really have to work at it too to get a good outcome.
Well, I'm impressed with the humbleness of the Bone and Joint Institute of Tennessee, and I appreciate that approach. Next time I fall on the ice again, I'm going to make lickety-split for you.
Very good. Well, if I could just put our phone number out there, it's 615-791-2630. That's 615-791-2630. We're going to be located in the Tower in Suite 409. That's 4323 Carruthers Parkway. And we'll be there for about a year while our new building is being built.
So you're open for business right now. And it'll be a short move for you.
That's exactly right. That's exactly right. We're ready to take on patients now.
Now, in the new facility, would you have inpatient surgical suites? And I would presume your outpatient, no, your inpatient surgery would take place here, but your outpatient surgery would be on site, right?
That's a great question, actually. We're actually having the capability to do an overnight stay at that location. So with the movement of outpatient total joints and some spine surgeries, even some foot and ankle surgeries where you have to stay one night, we would be able to do that and able to keep you in-house. We actually have a little bistro with pretty good food options too. What
is the technology like nowadays with with the things that you implant into a human being, whether it be a substitute for this or that?
It's a really neat time to practice medicine because we have things that we can manage pre-operatively, like getting CT scans or MRIs to really look and get a good surgical plan before the procedure. There are things like robotics that help us technically place things in the correct position. The Mako is a robotic surgery that our joint surgeons do, and then I myself with ankle replacements have a guide that helps me to anatomically place things exactly where they need to be. So, very advanced.
Now with Mako surgery, do you even have to be in the same building?
you are in the operating room. You're scrubbed in. Yeah, it's not just the robot doing the work. There's a
no.
Yeah.
Somewhere the fingers are at work.
That's right. Yeah, you got to have somebody running the machine for sure, and knowing exactly what the odds and ends are with it. But certainly it is a good tool.
Well, it's good to meet you, Geoff Watson. Please don't take my football kidding seriously at all, because I root for UT every game they play except one.
Actually, my brother-in-law is Coach McIntyre's his cousin, so there's a little Vanderbilt football in my family too. So good crew.
Well, you know, games you should never take seriously, but your health you better take seriously.
I agree. Thank you.
Good to meet you, sir. Would take you to break a leg, but that doesn't seem appropriate.
Probably not. All right, thanks for your time.
That wraps it up from Williamson Medical Center this morning on the Hometown Radio Show.